Hello, welcome to Legal Implication of Prescribing Error module. These are the topics that we will cover in this module. Prescribing error may lead to civil action, criminal charges, and medical board discipline action. Inappropriate prescribing of medication is among the top 10 reasons for physicians to be sued for medical malpractice. What happened in the past is that prescribing error have resulted in civil suit of medical malpractice. Now, to be charged as medical malpractice, the medical negligence due to prescribing error must have resulted in injury to the patient. The injured party, which is the patient, must prove that a standard of care existed, that the physician involved breached that standard, and that injury occurred as a result, and that the breach was a cause of the injury. Now let's learn from this case. This is a case of a nephrologist in Texas, USA. A nephrologist had a 72-year-old patient undergoing kidney dialysis who was admitted to the hospital for a toe amputation. During the patient's hospital course, the nephrologist wrote an order for 10 millimole of potassium chloride to be administered by intravenous infusion. Feeling that 10 millimole was insufficient, he increased the dose and requested to 20 millimole of potassium chloride by writing the number 2 over the number 1 without scratching out the original number 1. As a result, the patient was given 120 millimole of potassium chloride instead of expected 20 millimole. The patient had cardiac arrest and subsequently died. At trial, the defendant nephrologist argued that 120 millimole dose was so out of range for a normal dosing of potassium chloride that the pharmacists and the nurses should have clarified with him prior administering it to the patient. The civil court jury awarded the family of patient with $380,000 for negligence on the part of the physician. The next case is about a pharmacist in Ohio. He was sentenced to prison after the death of a 2-year-old child receiving chemotherapy. What happened was, the medication was supposed to be compounded using normal saline 0.9%, but instead was mixed using hypertonic saline 23.4% sodium chloride. After IV administration, the young patient complained of a severe headache and fell limp in her mother's lap. She was diagnosed as brain death from overdose of sodium chloride. The pharmacist was sentenced to 6 months of prison time and 6 months of home detention and was required to perform 400 hours of community service to include presenting to professional groups on the topic of medication errors and possible system to help mitigate the risk to patient safety. The next case is about illegible handwriting of the prescriber. This is a case about a cardiologist who has a 42-year-old American patient died after the pharmacist issued Isodil, which he interpreted as Plendil, as a result of illegible handwriting. The cardiologist had to pay compensation to the family of the deceased. The medical board has a role in protecting the public from unprofessional, improper, incompetent, and unlawful practice of medicine. The board is normally complaint-driven, requiring someone such as patient, family members, another healthcare professionals, or a pharmacist to file a complaint before an investigation can be initiated. The board is obligated to investigate all complaints. If the board determines that the minimal standard of care has not been met and the physician education can remedy the problem, education is required. If the standard of care was not delivered and the physician has committed a serious mistake, the board has the power to suspend or revoke the physician's license. When error occurs, what will be our approach? When error is discovered, the case needs to be reported in detail to the person in charge in the hospital, and an investigation is required. Patient need to be informed, and the error has to be transparent, as patient expect a genuine disclosure. You are expected to meet the patient with full explanation, accompanied with an apology and effort to prevent future error. Steps and efforts that have been done to prevent future error must be shared to the patient to ensure that the error will not happen again in future. How do we minimize prescribing error? How do we minimize prescribing error? Let me share with you one tips to minimize prescribing error. Write your name or a drug name as a prescription in your usual handwriting. Get your non-medical friend to transcribe your prescription. If he or she can transcribe accurately, that means your handwriting is fine. Tips to minimize prescribing error. Prescribing error is preventable if all of us are conscious and aware of our own actions. Try to have a good habit, which is always self-check after you write something. As medical students and junior doctors, you must equip yourself with good knowledge about all the commonly used medicine in clinical settings. Follow the step in prescribing as what you have learned in this prescribing skill before you prescribe a medication to your patient. With good knowledge and good prescribing skill, you can be more confident to work and be confident to prescribe a drug whenever you are called by the nurses on your first day as registered medical doctor. Errors can be minimized by creating a culture whereby seniors mentoring juniors in a more educational way and promote blame-free environment. When error occurs, analyze the root cause and change the procedure according to the lesson learned. Encourage other medical practitioners to learn the lesson from the incidents and avoid the recurrence of the same event in future. In conclusion, prescribing error can be improved by education, which is by providing the special learning module for graduates and undergraduates level. Apart from that, proper assessment of prescribing skill in undergraduates and postgraduate appraisal should be done during the training. Next is to use the National Prescription Form for hospital as a training tool. So just a recap, by now you have learned legal implication of prescribing error, action when error occurs, and how to minimize prescribing error in clinical practice.